everyone, I'm Dr. Pranjal Jain, and today we are back with another episode of concising and compiling stuff for you for your NEET PG exams. Today the topic is radiology. Radiology as such is very vast and very small as well. We'll only be looking at the theoretical points that need to be reviewed and re-reviewed and re-revised before your exam. And we'll complete it in a very short amount of time. The image part is already covered in all your other subjects, surgery, ortho, gynae, etc. Today we will only focus on the theory and rote learning stuff. So we will divide radiology into 5 or 6 major headings. That is radiation effects, units, contrast medias for different modalities, radiotherapy. All the pneumos we will combine together in a table because they are very confusing at a time. And then certain miscellaneous points. Starting off with radiation effects. Here we will see what part of the body, which cell, tumor, organ are more sensitive and less sensitive towards radiation, what is acute radiation syndrome, and how can we prevent the radiation effects. So coming to this table, here you need to have a basic idea that cells which are very active, either they have a very big nucleus or they are small cells with big nucleus, they are very active dividing cells, they will be more affected by radiation. Okay, something that is very active comes in the face will always be more affected by radiation. So see, dividing cells more sensitive as compared to the quiescent cells. Lymphocyte, it has a big nucleus, large nucleus, so it is most sensitive blood cell, whereas platelets are the least sensitive blood cells. Cell cycle, G2M, this is the most metabolically active phase of the cell cycle, hence most sensitive, and S phase is the laid back phase, least sensitive. Tumors, the tumors which are sensitive to radiation, that means for their treatment radiotherapy is a very great option, are the Wilms tumor. What does Wilms stand for? Wilms, Ewing's, leukemia, multiple myeloma and seminoma. When you read it at separate places, here it is just a compilation of all of them. So it comes naturally. Repeat with me. Wilms, Ewing's, leukemia, multiple myeloma and seminoma. And the least sensitive, where radiation or radiotherapy has no roles, are the HOMP tumors or ROMP tumors, that is HCC or RCC, osteosarcoma, melanoma and pancreatic cancers. Okay. Now, acute radiation syndrome. If you are exposed to a lot of radiation at a time, how will your body react and what systems will go first? To remember the order, you remember what was going on in cricket right now. It was the BGT series, right? So you will remember BGC, Border Gavaskar Cricket Series. Okay. So what is the acute radiation syndrome? It is blood or hematological, then GIT, and then your cardiovascular and your CNS systems. So at less than 10 gray, 1 to 8 gray, there would be blood or hematological side effects. At 10 to 20, there would be GIT shutdown, and at more than 20 gray, there would be CNS or CVS shutdown. Now for a radiologist, this would be very severe, right? You are being exposed to radiation every now and then you will have acute radiation syndrome. So that doesn't happen. We have ways to prevent it, like we wear the lead apron. Here the minimum thickness of the lead apron should be 0.5 mm, and to monitor the effects or to monitor the amount of radiation crossing the apron, we use the TLD, that is thermoluminescent disc, and we check the reports every 3 monthly. So basically 3 letters, 3 monthly, apron has 5 letters, 0.5 mm. So radiation effects is clear. Moving on to the unit systems. Radiation units and Hounsfield units. Radiation units, you need to remember a small story of your MBBS days. That is, first, when you say, what is this place you have come to? You use cuss words. Then you become a CR of your batch. As your journey moves forward, you become a JR, and finally you become an SR, right? So this is what radiation units is. So units for radioactivity is actually BC, becquerel and curie. Now who's the most exposed? Your batch, CR, so coulomb per kg and Rontgen. Now absorbed. When do you absorb knowledge? In what phase of your medical journey? It's your JR or your GR, Gray and Rad. Last, what is the most effective phase in your medical journey is when you become an SR, Sievert and REM. So activity, BC, exposure, most exposed or radiation exposure CR, absorbed dose JR and effective SR. Clear? Moving on to Hounsfield units. Here you need to remember that on a CT what appears white and what appears black. The things which are negative would appear black like air or fat. Things which are positive would appear whitish, the bone and the soft tissue, and water has an equivalent Hounsfield unit of 0. So that is all about the units in radiology. Moving on to contrast media. We have 4 major contrasts about which we need to know stuff. SonoView. नाम में क्या है? Sono. So it is used for USG. BaSO4, gadolinium and iodinated contrasts. Which modality are they most commonly used for? SonoView, Sono, ultrasonography, USG में use होता है. BaSO4 barium basically is used in your X-rays, gadolinium in MRI, and iodinated contrasts is used in CT scan mostly. Now side effects. Side effect of both MRI and CT contrast is they cause some renal failure. So we need to do a renal function test before that. MRI cause nephrogenic systemic failure. CT causes C for contrast induced nephropathy. Just different names for renal failures. Side effect or actually a precaution with barium is that it should not be used in case of perforation because it is an irritant. If there is a perforation, it will leak out and cause problems. Now something special about each of them is that SonoView and iodinated contrast, they are safe in certain conditions and actually preferred in those conditions. SonoView is excreted via the pulmonary pathway. The bubbles, they are exhaled. So it is renal safe, whereas iodinated contrast is perforation safe. In places where you cannot use barium, you use iodinated contrast. And gadolinium, something interesting I found out was it does not cross blood-brain barrier. Okay, now a little more about iodinated contrast. Iodinated contrast can be of 2 types, ionic or non-ionic. Ionics, their names end with 8, whereas non-ionic names end with all. Within this, we also have monomers and dimers. The usual trend is dimers will have a di in its name and rest everything would be a monomer. But we have one exception in ionic, that is ionic monomer is diatrazonate and any other name ending with an 8. But ionic dimer is ioxaglate. तो यहाँ पे एक छोटा सा डाई इधर आ रहा है and non डाई इधर आ रहा है. This is a small glitch here, but you need to remember. And non-ionic ones would be monomer would be iohexol and dimer would be iodixanol. If there is a di and an ol, it is a non-ionic dimer. Only an ol, non-ionic monomer. Okay. Iohexol, the other name for that is omnipaque. Now moving to radiotherapy. In radiotherapy, we need to know certain one-liners, okay? So intensity of radiation, we commonly know this as the inverse square law, that is intensity is inversely proportional to the square of distance. Now the most commons in radiotherapy. The most common side effect is erythema. Most common malignancy is blood cancer, but most common brain cancer is meningioma. So these are just one-liners you need to mug up. Side effect, erythema. If anyone throws any kind of radiation on you, you will have certain redness, erythema. What was the most common system to get affected in acute radiation syndrome? BGC, we remembered, blood or hematological system. So most common malignancy would be hematological or leukemia. But most common brain cancer is meningioma. Okay. Now penetrating power. This is something interesting. You have 4 rays, that is X-ray, gamma ray, alpha ray and beta ray, right? You remember them as 2 groups, X-ray and gamma rays, alpha and beta rays. Gamma, you remember it as Ma, your mother. So your mother can penetrate you deeply. No matter what kind of a sakt person you are, your mother can penetrate you. So penetrating power would be maximum for gamma. And tissue damage, can your mother damage you? No, never. So it is the least for gamma. Now we just assemble these groups together. So if gamma group is here, it should be more than X-ray, and then there would be alpha and beta. Gamma here is least, so gamma se zyada X-ray and then beta alpha. So just remember, gamma or mother penetrates you the maximum but damages you the minimum, and then you are sorted. Now the pneumos. I told you we'll combine all the pneumos together in the end, and this is a very important table because we often get confused here. The etiology for all these pneumos is more or less the same. There is some kind of trauma and air has entered an unknown location. So for pneumocephalus, it is spontaneous or trauma. Pneumothorax, trauma. Pneumomediastinum and peritoneum. Trauma nahi hoga, but there is some kind of rupture. So mediastinum mein your esophagus has ruptured, and in peritoneum your bowel has ruptured, bowel perforation. The radiology signs of all of them is super important. Pneumocephalus, air fills here. What is this? This has become a mountain. So the Mount Fuji sign is seen in pneumocephalus. Pneumothorax, we all know the stratosphere sign, the barcode sign, the absence of comet tails, and so on and so forth. Pneumomediastinum, again a very interesting radiological feature here. If air fills in your chest, it has to fill between the layers of your pect, right? It will fill like this, these lines here, and this is called as the ginkgo leaf sign or the spinnaker sail sign. And for pneumoperitoneum, any named sign apart from these 3-4 you have read here will come under pneumoperitoneum, be it simple air under diaphragm, regular sign, telltale sign, falciform sign, inverted V sign. You don't need to go into the details of these signs, what do they look like on X-rays, on USGs. You just need to know Mount Fuji, barcode and ginkgo leaf. Barring these, if there is any other sign's name, it has to be a pneumoperitoneum. Okay. The treatment for pneumocephalus and pneumomediastinum, there is basically only a supportive role. So you put the patient in Fowler position, give him oxygen, only supportive treatment, IV fluids, and this all. For pneumothorax, what we do is, first we insert a needle in the 5th intercostal space and then ICD in the triangle of safety. Pneumoperitoneum ke liye we take the patient immediately for laparotomy. Last, certain one-liners miscellaneous point about our modalities. First, USG probe. What is the principle of USG? Piezoelectricity, right? So from Z only, you will remember the USG probe has a lead zirconate. X-ray film have silver bromide. Spiral CT has some phenomena known as slip rings. PET scan is positron emission tomography. That is, positron is present here. And technetium. Technetium is a pure gamma emitter. It has a T half of 6 hours. Important. And various technetium scans that we use are DMSA, DTPA. These are for kidney. DMSA has SIR in it, scarring. DTPA and MAG3 is for renal function. सेस्टा में भी सबको पता है पैराथायरॉयड. Pertechnate is for Meckel's. MDP is for bone scan. And last, heart scans are important. Here, to monitor the ventricular function, basically the function of the myocardium, you use two M's, MUGA and MRI. For infarct is dil jale or pyro, so technetium pyrophosphate is for infarct. And to see the perfusion, we have the others, that is thallium, tetrophosmin, etc. Okay. So with this, we come to the end of a very quick, crisp radiology theory revision. This was just the theoretical and rote learning points of radiology, which you need to see before your exam. Images are there at the back of your mind and you will remember them during your exams. Just see these theoretical points once more and you'll be sorted for radiology. Thank you.